I'm Gloria Hernandez, Energy Manager with SRP and a proud graduate of the Hispanic Leadership Institute East Valley, class of 2016. Valle del Sol has committed itself to meeting and adapting to the needs of our community. When it became evident that the health needs of our students and school staff weren't being met, Valle del Sol stepped up to fill the gaps in services through its school-based services program. Over the past few years, Valle del Sol has increased its impact to over 50 schools in Central Arizona, helping our schools support and nurture successful students. SRP is proud to support Valle del Sol and their work addressing the behavioral health needs of our students and teachers. Congratulations on 50 years of service.
Cada cabeza es un mundo. Meeting patients where they're at is one of the core tenets that Valle del Sol has embraced over its 50-year history. 6 years ago, Valle del Sol was approached by concerned educators and school administrators in the Metro Phoenix area. They were seeing an influx of parents needing behavioral health support for their children. But these families were not familiar with the process. If they were largely uncomfortable with seeking the services of a traditional behavioral health agency. Barriers such as cultural stigma and access to transportation can hinder families from getting the care they need.
And when you're in your stage of change, when you're really ready for help, that can be a very terrifying process, and it actually can limit you on actually following through and getting that help you need. And so what we decided to do with school-based services is by making a relationship with the campus makes that connection with the family and sends them to us, and they tell us, hey, this family's ready for some help. Can you help them? And instead of the family going through that rigmarole trying to get help, we actually start calling them and connecting to them and start building those relationships way before any of the more intense clinical stuff happens.
Public schools are trusted community centers in many neighborhoods. They work not just to meet the academic needs of students, but to ensure students and their families have all the support they need to live healthy, happy lives.
When we were able to meet them on campus, because we were able to do assessments on campus in that comfortable environment and have those conversations of what is mental health, and teachers are kind of able to prime and support the family in understanding. Once we help teachers understand what we do, it's just a smoother connection. I think families feel more comfortable with that.
Starting with just 3 schools, word began to spread about the positive impact of Valle del Sol's school-based approach to services. By providing direct behavioral health care on school campuses, Valle del Sol is able to connect with administrators, educators, and families to better understand the needs of the school as a whole. This connection creates a familiar and more comfortable way to ease children and families into the process of seeking mental health care.
With that, we saw a major increase in people actually showing up to their appointments. They were coming, they wanted to engage, they were calling us more often because they actually had connected to people, and we were connecting to them at their school sites as well.
Valle del Sol recognized that by supporting not only students, but teachers and administration as well, this would foster a healthier environment as a whole, benefiting the entire school community.
Schools are your community, right? That's where your kid goes every day. Your kid spends as much time at school as they do at home, if not more. The adults at school are immersed in your children's lives, and we need to see positive relationships. We've now shifted to looking at the school as a whole. And so we are now part of systemic change for an entire process. And so we give just as much time and energy and support services to the teachers and the admin staff at those sites. And by providing that, we're creating these wraparound models and these actual systemic change models that help all the kids, not just the kids who are being referred.
That systemic change is critical to the families Valle del Sol serves. It gives educators and administration an opportunity to de-escalate and divert a student that could potentially be sent to a school resource officer. This means fewer students being introduced to the school-to-prison pipeline and more students staying in the classroom.
having the school be that involved and connected to the family brings some of those trust connectors back. So instead of the school being the place that your kid gets in trouble at because of their behavioral health needs, instead it's a supportive environment saying, hey, we see that there might need to be some more help and we have somebody who could come help you.
Valle del Sol is now partnered with more than 50 schools across central Arizona. What began as a program with a small staff has now become one of the most highly regarded in the state. In March of 2020, Valle del Sol's Senior Operations Clinical Director, Caitlin Gisler, testified to the Arizona State Senate in support of Jake's Law, a law that prohibits insurance companies from denying coverage simply because they are delivered in an educational setting.
It's not just about bringing therapy to a campus. It's about helping campuses change to become healthier environments for everyone there. Not just the students, but also the teachers. Mental health is part of your healthcare and everyone needs it. Everyone deserves to have that kind of support. And school campuses are a place to do that.
True to its founding, Valle del Sol saw the need and created this innovative program, all with the community at its core. When our students and their families are supported, it will positively impact our community for generations.